A recent decision by the FDA last week effectively is going to condemn 40,000 Americans to death. And here's why. There's been a big political pushback against the idea that somehow the vaccine is being rushed or done for political reasons by the left wing, particularly Kamala Harris. And the result is that the FDA, for whatever reason, caved into this and ordered a 8-week or roughly 2-month period in which they'll continue to monitor people that were involved in the phase 3 trials after the vaccine would have reached its normal approval level. In other words, previously, once you reach this level, you can go ahead and approve it. But they're going to delay it. And here we have a situation where people are dying right now. This is not a new vaccine against something that isn't having much of an ongoing issue, but just something that for preventative purposes. People are dying at a rate of a little over 700 per day, based on a 7-day moving average of the Johns Hopkins data. So the faster we can get an effective vaccine to people that are most at risk, the faster we can save lives. So this is why I think this is very outrageous, particularly in terms of the people that are most at risk. So, by the way, I want to mention that if you like these videos, please, and have a YouTube channel, please subscribe if you haven't already, and give me a like. It will help us out here. And you can also forward them to people that might be interested. But let me go along a little bit further with this and kind of explain a bit more in detail what I'm talking about here. In fact, given the vulnerability of people over 70, but particularly those with pre-existing conditions to this disease, that's where almost all the deaths occur. It's important that we get a vaccine to those people in the nursing homes and residence homes and so forth, and the people with pre-existing conditions in that age group as soon as possible in order to save their lives. I mean, this is not a question of nicety. It's a balance of risk issue. For example, President Trump recently was, of course, diagnosed with COVID-19, and within a day was given a experimental treatment based on antibodies that was still in phase 2, and it had a remarkable effect on him. And so here we have something that's way past. It's already gone through phase 2. It's deep into phase 3, and we're talking about the normal completion time for phase 3, yet we're still going to hold it up for those most at risk for another 2 months while 40,000 of them die. I mean, this is asinine. Just to do some political nicety, I mean, it's outrageous. In my opinion, we should go ahead and particularly approve it for those most at risk. I could see holding it up for the general population, and there's no reason to, take extra risk if there are any potential side effects. But if they hadn't been detected by the end of this fairly extensive phase 3 trial, my opinion is that the balance of risk is to go ahead and save those in need. After that, of course, I'm sure that it will become available to the general population. By that time, we'll have enough cases. We'll have millions of people who have had it. At that point, we will know anything. But for most people, those under age 70 or so, under 65, that don't have major pre-existing immune deficiencies or something, they're not that much at risk anyhow. And so we can hold off on them actually getting the vaccine until later. But those most at risk should get the vaccine and as soon as possible. I can see no justification for holding it up if the normal criteria for phase 3 approval have been met. So at any rate, that's essentially what I have to say about this. I think if you could contact your congressperson or senator and tell them what you think about this. I mean, I'd like to get this idea a little bit into public discussion because it seems to me that the faster those people most at risk get a vaccine, the faster this COVID crisis can be brought to a close. And then after that, we'll have the vaccine available, of course, next spring, probably for everybody. But at any rate, so this is basically my comment for today, and until next time.